Peter Aldous.
Thank you very much, Madam Deputy Speaker. I congratulate my honourable friends, the members for Hastings and Ryan Darlington, for so ably leading this debate and setting the scene. Whilst it's important to recognise the great work done across the eastern region by East Anglia's children's hospices, in the Great Yarmouth and in the Waveney area, as represented by my right honourable friend, the member for Great Yarmouth, and myself, there is at present a hospice vacuum. Throughout the rest of Suffolk and Norfolk, there are locally based hospices well embedded in and providing great services for their communities. The good news, Madam Deputy Speaker, is that plans are being carefully prepared to fill this vacuum and this void. A local partnership is evolving to build a local hospice led by St Elizabeth Hospice and including the local NHS, councils, a community interest company, volunteers and fundraisers. To be successful, to open the hospice and then to run it, national government must join this partnership. And I hope that my right honourable friend, the Minister, who is currently not in her place, in her summing up, will accept this invitation. Madam Deputy Speaker, the Waveney and Great Yarmouth areas desperately need a hospice. We have an ageing population, pockets of deprivation, and as Chris Whitty has highlighted, there are acute health inequalities in coastal communities which a hospice can help level out and remove. As I've mentioned, a well-researched case for the hospice has now been prepared, though it is important to recognise the work done by so many over the years in supporting those in need of end-of-life care and their families. The late Margaret Chadd, who founded East Coast Hospice, had the vision of building a hospice on land bought at Galston. Roberta Lovick, who founded the Louise Hamilton Centre, from which such great support is provided to patients with life-limiting conditions and their families, to the James Paget Hospital, where the Louise Hamilton Centre is based, and to East Coast Community Healthcare, the Lowestoft-based community interest company, who in partnership with St Elizabeth operate 6 specialist beds in Beccles Hospital, as well as providing care in both people's homes and in care homes. Madam Deputy Speaker, building on the work of these local people and these local organisations, a framework is now emerging through which a local hospice can now be built. The cornerstone of this is, of course, as we've heard, the Health and Care Act of 2022, which sets out the legal requirement for ICBs to commission palliative and end-of-life care. The Norfolk and Waveney ICB have responded by carrying out a review of palliative and end-of-life care. This was completed last autumn and highlights the need for 9 urgent and 6 medium to long-term actions. Last March, St Elizabeth Hospice merged with East Coast Hospice and straight away set about conducting a feasibility study into the viability of building up hospice facilities on the Galston site. This study has just been completed, and the conclusion that has been reached is that a hospice should be built in stages, and expressions of interest are now being invited from architects. Madam Deputy Speaker, this is an exciting landmark for which so many people have strived for so many years. St Elizabeth are confident that they can successfully fundraise for hospice capital appeal. However, it is with the ongoing revenue cost of providing core clinical services for a full inpatient unit, as well as outreach community services, that national government support is required. The Norfolk and Waveney ICB, and indeed all ICBs, need central government support and a fundamental rebalancing of national policy so that they can meet the projected growth in demand for palliative care. Madam Deputy Speaker, it is good news that after so many false dawns, over so many years, we now have a coherent and well-thought-through plan for filling the hospice void in the Waveney and Great Yarmouth area. Whilst we should be sanguine, we should also be realistic. We are not even at the starting point as the rest of England, as we've heard from those other colleagues who actually have a hospice up and running. We don't. And that is why the government need to join the partnership that has evolved and support the Norfolk and Waveney ICB so that they can commission hospice services on a long-term, multi-year basis. And I urge the government to join us on this exciting journey. Thank you.